Let's talk about a topic near and dear to my heart, direct primary care, also known as DPC. Direct primary care is a new way to pay for and deliver top-notch primary care. It's the kind of primary care every patient wishes they could have. It's the kind of primary care physicians wish they could provide. But we've all been made to believe it just doesn't exist. DPC is all about the relationship between a patient and their primary care doctor. There is trust. There is easy access to meet healthcare needs and get questions answered. And there is time for the doctor to really focus on maximizing health and wellness. DPC doctors and DPC patients are the happiest I know. And that is truly remarkable in a healthcare system, which is often a frustrating and expensive disappointment. How does DPC accomplish this magic? By abandoning health insurance. Sure, patients can use their health insurance whenever they need it to pay for healthcare, just not in the DPC. A DPC doctor won't bill your insurance, but will instead collect a monthly membership fee, just like a gym membership or a Netflix subscription. The fee covers just about everything, all the visits, all the telehealth, all the messages, with no hidden cost to the patient. But there's a hitch. Someone has to pay that membership fee. Rather than the primary care practice passively receiving patients by being in a network with insurance companies that steer patients to the practice, DPC owners have to actively drum up business for themselves. And to do this, they have to convince someone, patients, parents, employers, for example, to pay the fee, and that there is value on the other end of that fee. This idea of marketing oneself turns out to be rather anathema to physicians, especially in primary care, a specialty area where there is a growing workforce shortage, and the problem is more often one of too many patients. I was never taught how to market myself. I never even learned that was a thing. The idea of marketing myself or my practice has frankly felt intimidating to me. And from talking to other DPC doctors, I don't think I'm alone. I think it's a pretty common struggle. Well, good news, folks, because our guest today has cracked the code on successfully marketing a DPC. He owns a thriving DPC pediatrics practice in Lincoln, Nebraska, and I absolutely love his be a helper approach to marketing. He's figured out that the way to market primary care is to find the sweet spot where physicians like to help and patients need the help, and then just start helping. It's bringing families to his practice in droves, and I'm so excited for our conversation today. Let's get started. Hello, and welcome to The Pulse, the Elation Health on-demand interview miniseries discussing hot topics across primary care, health tech, and the healthcare landscape. I'm your host, Dr. Sara Pastoor, family physician and Senior Director of Primary Care Advancement at Elation Health. The topic of today's interview is direct primary care, marketing your practice. Today's guest is a very special Elation customer, Dr. Philip Boucher. Phil is a pediatrician and father of 6 in Lincoln, Nebraska. He's been a pediatrician in Lincoln for over a decade and started Nebraska's very first pediatric DPC 2 years ago, which has grown to over 500 members. He also teaches private practice owners how to use in-person and online channels to grow their impact and practices. Specifically in DPC, he focuses on helping doctors break out of their shells and put themselves out there to grow the know, like, trust factor that is essential for patients making the leap from a fee-for-service practice to DPC. You can follow his practice on social media at Phil Boucher MD. That's at PhilBoucherMD, and learn more about his marketing work at pbmd.co. Welcome to the show, Phil. It's so good to have you here.
Thank you so much. I'm so excited to get to talk with you all about marketing and DPC and everything in that realm.
Great. Well, let's jump into our very first question then. So briefly tell us, what does direct primary care mean to you and what is it not?
To me, direct primary care is about building relationships with families. The word direct in there means that there's no middle person that is influencing what you're able to do in your practice in terms of all of the nice features that DPC practices get to build into their practice, like text messaging, like virtual appointments, like not having to come in for every little thing, but being able to discuss things over text, telemedicine, email, whatever media is appropriate. That's what the direct means to me, is that instead of, I can't do that, no, you can't text me a picture of your rash, insurance won't pay, we just say, yeah, please text us a picture of your rash because we can probably save you a visit, and take care of you and get you the reassurance or the support or medicine or whatever it is that you need without necessarily having you have to come into the office. And so to do that, it's about having a relationship with the patient. And as you said in the introduction, we have the time, we have the space, we have that small practice panel that allows us to serve patients in a very different way. When a parent calls and says, my son Leo needs to be seen, my staff don't say, okay, well, what's his date of birth and which doctor does he see and all that. We're like, oh, Leo, yeah, how was soccer last week for Leo? Oh, shoot, he got hurt. Well, let's, you get to form those relationships where the patients, the families, and the families know you, and you have that mutual trust that you just don't see in healthcare anymore, where it's very much large volume. You're a number. You have to wait weeks and weeks to get in to see your own doctor. If you want to actually see your doctor, it's going to be a wait. Direct primary care is the opposite of all those things.
I love that. I love that so much. And I recently started following you on your Instagram page, and I just love, love, love the content that you're producing there. And one of my favorite things is how you talk about newborn visits. What does a newborn visit look like in a direct primary care pediatrics practice?
So in a direct primary care pediatrics practice, a newborn visit looks like we see baby in the hospital, and then when we go home, we just tell them we'll come out to your house tomorrow and we'll see baby. Because most parents love not having to pack up from the hospital, go home, unpack while recovering from delivery, while taking care of a newborn, and then turn around the next day, drive to the office. Well, you got to get the baby in the car seat to make sure they're okay in the car seat. Then you got to get all your gear, and then you go to the office and you wait in the waiting room, and there's 6 sniffly kids around, and then you go back to the room and it's cold and it's sterile, and you have to wait, and your baby's hungry, and can I feed them? Is this a good place to feed them? All those different things that come up with a brand new baby while recovering from delivery and everything like that. Instead, we just say we'll be out around 9:30 tomorrow, and we go to their house. We do their visit in their living room. We have all the gear that you need. I mean, there's not a lot of gear. It's a lot of talking and figuring out, is baby eating okay? Are they growing okay? What questions, what parenting things came up since you left the hospital? We're able to do all that in their home. One thing that we didn't realize when we, packed our bag to go to the house, stethoscope, stuff if we needed to draw a bilirubin. The thing that we needed the most was a lint roller, because everybody has dogs and cats, and we leave just covered in dog and cat hair. And so that's what we do for newborn visits, and families love it. I think initially we were like, well, I don't know if people want us in their homes. They're probably messy. Nobody has turned us down from not having to leave the comfort of their home, having a newborn, and we're parents ourselves, so we totally get it that, like, your house is messy after you have a baby, and after you have kids in general. And that hasn't dissuaded anyone from having us come out to their home to do their newborn visit in the home. We also have a nurse practitioner in our practice who is a lactation consultant. And so she'll go out and do in-home newborn visits. And what we found is, typically you go and you do a lactation consult at a big office or hospital or something like that, and you get everything squared away in their chair with their pillow, and then you go home and it's totally a different ballgame. And so we just do it in their home so that we can have our nurse practitioner show them exactly, here's how you feed in on your couch and your chair and in your bed and all those different places. This is what it's actually like, and families love that too.
Wow, it's been a long time since I had a newborn, but I wish so badly that we had something like that. Like the membership fee covers that priceless experience alone. I absolutely love it. Well, let's move on
For
to our
sure.
next question. So, tell me, what are some of your favorite marketing strategies to building your patient panel?
I think one of the things that you highlighted is that in a traditional fee for service, you don't really have to do any marketing. You can if you want to like try and edge out the competition, but by and large, insurance drives, do you take my insurance? Do you take my insurance? So they go on the Blue Cross website and they look to see who's in their network and who's covered and who's nearby, and that's their doctor. In direct primary care, you have to go and convince people that you know what you're doing and that it's worth this new model that is a little bit foreign to most people as to how does it work and what's covered and why am I paying for this and for my insurance premiums. It's about making sure that they understand the value and communicating the value. And so that by and large is the biggest difference between a fee for service practice and a direct primary care practice is you have to convince people of the value a little bit. And so when it comes to actually doing that, I always tell practices and physicians to just go where your people are, and you will be able to market there to them and make them feel understood and that they can trust you and that it makes sense. And so when I say go where your people are, I actually mean pick a specific person, like not just kind of, okay, I'm a family practice doctor, so I take care of, infants through 90-year-olds or whatever it might be. Well, that's way too many people to try and serve. Like nobody's going to feel like you're speaking to them if I'm a 38-year-old, professional, and you're talking about prescription drugs or you're talking about newborn care. Like those things don't resonate me. So what you're going to do is you're going to pick that specific person and you're going to talk specifically to them where they are. So it might be expectant parents. It might be retirees. It might be middle-aged accountants that want to have more energy, or late 50 somethings who want to be able to get down on the ground more easily and play with their grandkids. You're going to pick that specific person and you're going to talk to them. And so when it comes to the channels of deciding where to do that, I mean, everybody has a phone and is on their phone and is on social media. So that's kind of like one place that you can do that. For these examples, expectant parents are on Instagram and TikTok. Retirees are probably on Instagram and Facebook, and then they do local meetups and meet with their friends and at local opportunities to meet up. Middle-aged accountants, they're in small business groups. They're on LinkedIn. Those are where to find them. Late 50-year-olds are probably at the gym if they're wanting to gain more energy. They're probably on Facebook talking to their friends. Those are places that you can find them. And the nice thing is, most companies, when they want to do market research, they have to hire a firm. They have to figure out where these people are. They have to do all sorts of survey monkeys and all those sorts of things. You have people in exam rooms 1, 2, and 3 that you can just ask. And you can say, hey, where do you get your health information? Where do you go to connect with others? Like, are you in any small groups or anything like that? Do you ever need a speaker? There's so many opportunities to just ask, where can I be? Where can I help? And then you just go to those places, and then it makes it so much easier than trying to make it so complicated or make it too complicated or speak to everybody at once. Pick one specific person that you want to speak with, make some content that would interest them. And then once you've done that and you've gone to some local meetings where those people tend to gather and share there, then pick another subset and then talk to that person. And you can reuse that content and those meeting ideas that you come up with over and over and over again. But you really have to speak directly to that middle-aged accountant about why a DPC practice makes sense for them, or why a retiree who's paying a ton for prescription drug prices should switch to your model because it actually saves them money, doesn't cost them anything, and they get the care and all those sorts of things. Or expectant parents, you have to speak specifically to them and say, we do in-home newborn visits, and this is why, and this is what it looks like. You just can't try and speak to everybody at once. And I think that's where a lot of people fall short, is they try and share about their practice and how we see all these different people. People want to feel known and heard and understood specifically, and that they get me. And once you focus in on that, then it gets much easier to create content and also to speak directly to them so they feel known and heard.
Great. So it's really about targeting your messaging to a specific audience and finding out what's going to appeal to them, and then figuring out where you can help.
Exactly. So for me, that looks like we're a pediatric practice. We want newborn babies because they don't have to switch from their regular pediatrician to us. They're already, like looking and actively looking. So if we can target expectant parents, what that's going to look like is content around newborn life and all of the things that parents have when it comes to questions about the delivery process, what the first week looks like, what sleep looks like, what feeding looks like, all those sorts of things. And then the local places where they gather at the hospital to do their like prenatal classes and those sorts of things. They go to baby showers. They go to different places where if we can insert ourselves in, or if we can provide them with something that makes them feel that like gets our name out there, then we can start that conversation. And then we can say, did you know that like you don't have to necessarily go to the office the day after you leave the hospital with your baby? We do in-home newborn visits because we know what a hassle it is to pack up your bags and pack up your baby and go sit in an office. Those are the ways that you kind of get out there in front of them. And then for pediatrics, we want families that have young kids because they're going to be the ones that feel the pain point of calling and leaving voicemails. Sick kid can't get in for 2 more days, being told to go to urgent care or the ER or just to wait and we'll get them in at 8 o'clock tonight or something like that. They can feel those pain points. And so the ways that we do that, I mean, on social media, on Instagram and on TikTok and on Facebook, where those people are. But then we go to MOPS groups, which is moms of preschoolers, moms of preschoolers. So we go to groups like that. We talk, we share information, we make them feel heard and understood and answer their deepest questions that they have. And then over time, they have enough of those wins that they say, well, yeah, this makes sense for us. This makes sense for our family, or at least I want to learn more and see if it makes sense. And that's kind of how we in pediatrics find those new patients.
Love that. Let's move on to our next question because I think this one is a really rich part of this topic, which is, what are the most common obstacles to this successful marketing? You've identified, the right way to do this. So, what are the obstacles that you see, and how do you overcome those?
The only obstacle to marketing your practice is between your ears, and it's right in here. And it's the things that we've been told and trained and taught. Perfectionism is ingrained in us from undergraduate and medical school and residency. Perfectionism stands in the way. Being told that doctors don't market or that they don't do social media or those sorts of things stands in the way. And then that it's too complicated or it takes too much time, which is also related to the perfectionism too. Like, I can't figure this out. The marketing itself is free. And the nice thing about DPC practices, you said it, you get more time with patients. Your schedule isn't as busy. If you can schedule 10 minutes per day dedicated to your marketing, you can do everything that you need to do and be done after that. And what we have to push back against is a perfectionism. What you have to realize when you're trying to, get your camera set up just right and your microphone and your ring lights and all those sorts of things, is that in one day, the average American scrolls the Statue of Liberty in length on their phone on social media, which means they're scrolling super fast. So even though you care that the lighting is perfect and the sound is right and the camera is right and you take 7 tries to say your first line, they're all scrolling so fast that you just have to get them to stop and you have to get them to listen for just a few seconds. And that's all it takes. And it doesn't matter how pretty the background is or that the lighting is perfect or those sorts of things. You have to capture their attention. And you can do it all with your phone. You don't need to get the expensive stuff that slows you down and hooking the right cameras up and the microphones and the ring lights and all those sorts of things. The perfectionism stands in the way until you say, well, they're scrolling so fast that I don't really think they care if I'm filming this in my car and there's crap in the back seat and my kid spilled goldfish all over the floor. Well, actually, that's probably going to make them feel more connected to me. If they're a parent and they say, hey, look at that doctor. He has goldfish all over the back seat of his car, just like I do. Oh, well, he's kind of like me. Like he gets it. He gets me and gets the problems that I face. And then the marketing component of it too. It's hard to be a business person. Like there's a lot in direct primary care that you're just not exposed to during medical school residency, academic life, big corporate life, those sorts of things. And so you feel like this is just another thing that I have to learn and that doctors don't do that. Well, when you're going to own and run a business, the marketing, the sales, the leads is a part of that. And so we have to get out of our comfort zone and say, well, we can probably figure this out because there's a million small businesses that open every year that figure this stuff out too. And so I can probably figure it out too. And then the time is, well, it actually doesn't take that much time if we can practice, if we can get good at it, if we can do it on a regular basis and we're not starting from scratch every time, if we know what we want to talk about and we have a script and a framework for how we're going to talk about it, then it takes so much less time to actually put that content together and just put it out there, because people are scrolling so fast that if it sucks and if you misspeak or something like that, people are scrolling so fast they're not going to remember that. They're not going to be thinking about that over dinner tonight, how they missaid a word, or a bird flew by their window and they got distracted or something like that. uh, what you have to do is just put it out there and get those reps in so that you get more comfortable with it over time.
Yeah, that's what I was going to say. I imagine that, it just gets easier with practice and you get more comfortable with it.
So much easier. Yep, it just takes time and practice. Like uh, my first video that I did, this was before I had even had I didn't even know what DPC was then, but I've been creating content for a long enough time now that this was in like 2017, and it was a video about how to start your baby on peanut, because I was getting that question a lot in the office, and honestly, like I was in a busy practice, I was an owner, I just didn't have time to talk with patients about all those things in the depth that I wanted to. So I said, well, maybe if I just make some videos, then I can just refer them to those videos, save me time so I can move from room to room to room. It took 3 hours just to set up my video camera and my microphone and those sorts of things to record a 2-minute video on how to introduce peanut. And over time, it has gotten so much easier. And now I just pull out my phone. I say, a patient just asked me about this, and I wanted to quickly tell you, here's what I tell patients, and just record that really quickly, get that information out there, and it's because of the practice that comes with time that it gets just easier and easier to say those things, to make that one point that you want to make, and then to move on from it, and you realize what resonates with the people that you're trying to speak with.
And you're just putting so much value out there into the world for free.
Yeah, I mean, that's the nice thing too, is Instagram is free, TikTok is free, Facebook is free. Going to a local MOPS group or a group of retirees is free. Like they're just out there waiting to get good information from people that they can trust. And despite everything in the past few years that has hurt the trust that patient and physician share, the trust is really high still, despite that. As a physician, you already have so much more street credit just by showing up than those that are just like the influencers on Instagram or TikTok or Facebook or wherever. And so if you get out there and start talking, people are going to listen. And even if they have these reservations and these concerns, they're still going to give you a lot more credit than they'll give that random person that's telling them they need to do this, that, or the other thing. And so all of the marketing channels are 100% free. It's just being able to get out there and take the time to get on those platforms, get in those specific channels to share that information. And if you, like from a in-person marketing perspective, if you find out where those groups are and you say, hey, I'm a physician and I often, help people like your group members, I would love to just come and answer questions for your group or speak on a specific topic that I'm passionate about. They will just be, falling over themselves to book a time with you, because those groups need people to come and talk to them. They need to, get people to come to their meetings. And if they hear that there's somebody that's willing to give their time and to help and to get those questions answered, they'll be all over it. And so it's not difficult to get in front of those groups. And then you just share helpful information, you answer their questions, you make them feel understood, you make them feel like you get the problems that they're facing, and then you tell them how you solve their problems differently than they're used to, and offer them the opportunity to do a meet and greet to find out if they're a good fit for the practice that you run.
Again, coming back to that helper mentality. Yeah, so all of this stuff is perfectly free. You make it sound so easy. A good segue to our next question, which is what about marketing consultants? Should we invest in those things? Will that make me more successful? Why or why not?
So, as somebody that does marketing consulting for practices, I would probably say no, you don't need my services or the services of anybody, because as a DPC, as a startup, well, one, you're trying to, stay lean when it comes to cost. And two, it's all free. Like getting on social media and those things are all free. And so oftentimes what practices will do is they'll have, okay, we need to get on market, we need to do more marketing, we need to do those sorts of things. Let's just jump on and start doing stuff and see what works. If instead you have a game plan, at least, if here's what I'm going to post about and here's how I'm going to post and those sorts of things, I think that is helpful. Because if you just kind of go on and start talking about your practice, and if you're don't really have a plan for what you're going to post and share, then it often just becomes something that is a back burner that eventually the flame goes out and you don't do anything. And then 6 months go by and you say, oh yeah, how's our Facebook page? Well, we haven't posted in 6 months. So it's not doing very well. If instead you have a plan, and you can come up with a plan for yourself, you can watch videos, there's so many people that talk about all the marketing strategies and all those sorts of things. You can come up with that plan of how you're going to speak specifically to those patients that you want to attract to your practice. Then try that and see what works and what doesn't work and what people resonate with, and ask your own patients, where do you find health information? What would be helpful things for you to know? You probably don't need to work with a consultant. What I typically do with practices that come to me is I say, here's what you're doing now. Here's what would be the dream. Let me give you some guidance and suggestions on how to get from what you're doing now, which isn't as effective as you want because we're having this conversation, to here's the dream. And the dream is you put out new content every day without having to spend a lot of time on it. You are speaking to the people that need to hear you and hear your message, and that's driving new interest in your practice, foot traffic to your practice, of new meet and greets, new people signing up, and those sorts of things. And then once you have those things dialed in, you put it on autopilot. So you don't have to spend any time on a daily basis on it. And maybe once a week or once a month, you're putting time and attention into your marketing because you have a machine that's going and it's working even when you're asleep, that people are scrolling through social media while you're out with your family, learning about you and your practice. And once you can dial all those things in, then it can go on the back burner and it'll just keep simmering on its own, but you won't have to be constantly tending it and constantly thinking up new things to do. So if you're going to work with somebody, have that plan rather than I'm going to pay them $500 a month, $1,500 a month to take care of my marketing and social media. And they'll put posts out about happy Halloween and happy Flag Day, and nobody will really care. Because if I have so much scrolling to do. I have to scroll through the Statue of Liberty every day. If I'm seeing posts about happy Flag Day, I'm just going to keep scrolling. Or the office is closed on Friday afternoon for a staff in service, don't care. It doesn't affect me as the patient. So instead, if you can come up with that plan and then work with somebody that can help you execute that plan and then put it on autopilot, then you're not paying $500, $1,500, $2,500 per month for them to create posts and do content for you that really doesn't resonate with the people that you want to speak to.
Okay, that was super helpful. I think that, the probably path of least resistance, or maybe the comfort zone, is to just hand this off to someone else. But as you said, especially when we're building our practice, we're really running on a very lean budget, and that kind of investment maybe is an expense that we can avoid if we just lean in a little bit to this discomfort of marketing ourselves by practicing, getting those muscles working, and putting some content out there, and targeting the message to specific populations around the things that matter to them, and doing it in a way that is all about being a helper. I love that. Great. So this has been an absolutely wonderful conversation, Phil. I cannot tell you what a delight it has been to talk to you and to learn from you. If you, our audience, have questions or feedback about this content or have ideas for a future episode, please don't hesitate to contact us at marketing@elationhealth.com. Thank you so much, Phil, for sharing your expertise with us. Again, it was truly a pleasure to have you on the show. And thank you to all of you who tuned in to our session. We're so glad you're here. To learn more about Elation Health, please visit elationhealth.com. To access our webinars and Pulse episodes, visit elationhealth.com/resources/webinars. All other inquiries go to marketing@elationhealth.com. Thank you so much.